Hi, I'm Dr. Olurotimi Badero, an interventional cardiologist. I works with Lagos Hospital. We're here in the CathLab at Lagos Hospital, which is one of the recent cath labs in Lagos State. We just want to raise awareness of peripheral vascular disease, which is some of the things that we do here in this lab, peripheral vascular intervention. PAD, or peripheral arterial disease, is something that affects 1 out of 20 people, especially in the United States. And it's something that's 5% prevalence rate in the United States. And I think in Nigeria it's actually even getting worse now because it's under-recognized and under-diagnosed. And there are risk factors for this disease, which include hypertension, diabetes, smoking, obesity, hypercholesterolemia, which is just having increased cholesterol intake. This disease is something that I think the prevalence is going up and it's not recognized. So there are things that we should look out for. If you're having pain when you walk, what we call claudication, and if the pain gets worse when you walk and it gets relieved by rest, then you should see a doctor. It's recommended that if you're above 50 years old and you're diabetic, you don't make sure you have diabetes, you should be screened with what is called an ABI, which is an ankle brachial index. If you smoke, you also should be screened. If you're above 70 years old and you don't even have a smoking history or diabetes, you'll also be screened. So we just want to raise awareness and make people aware that this is something that people need to do. You need to talk to your doctor about your symptoms. And there's some simple tests that can be done. They can check the blood pressure in your ankle and one of your arms and compare the ratio and see what it is. And they can do an ultrasound as well, which we do here in the hospital. If you're found to have peripheral vascular disease, it's better for you to be taken care of earlier. You can start with medical therapy, using some medications. And if it doesn't improve, there are some procedures that we can do to open up the blockage and increase blood flow to your legs, because that is important. Because if you don't do that and you develop an ulcer, especially if you're a diabetic, that ulcer does not heal. And in some cases, people get amputation, which also can be prevented, with some of these procedures. So this is the cath lab at the Lagos Hospital. We do some procedures that range from coronary procedures as well as peripheral vascular procedures. And we're here to help the community and basically just to increase the awareness of heart disease. And these are expertise that have been brought from overseas, from US and UK, and we're bringing it back home to help, also to give back to the community and to help the people here live a better life. Thank you for your time. We will look after you.